Hello, my name is Sarah Barron. I'm a professor at Central Oregon Community College, and this is a short clips of Public Health 101 series. I've adopted the Center for Disease Control slides and going to hit on 6 different topics in short little YouTube videos. The first one I'm going to hit is public health definition and key terms. And we're going to take a look at the public health approach. The public health approach is about protecting the health of the entire population, preventing problems before they happen. So really thinking about how can we prevent people from getting sick or injured. And then there's a big social justice component of public health, of really looking at healthcare equity and looking at the quality of healthcare and whether it's accessible, and also looking at our environment to see if that's healthy and whether it promotes health and well-being. And this graphic here kind of gives you an idea of some of the key things that public health does, from surveillance to looking at outbreaks. And an outbreak can be anything above what is typically seen. You'll see an outbreak happening in a community of a disease, and an epidemic is basically anything that is above and beyond what's typically seen in a community for a disease. So you could have an outbreak with just one case of disease. And so we're constantly looking at how to prevent outbreaks and communicate how to prevent these, and looking at research and health promotion. One of the big things that I want to stress is that public health uses a really holistic approach, in a sense that it looks at the primary focus on the population, on how can we keep a whole community healthy. And one of the big things is that it tempers, and what I mean by tempers is that the individual is important, but the concerns of the individual are placed behind the health and well-being of an entire population. It really focuses in on prevention and health promotion. And it looks at the interventions, and it looks at environment and human behavior, lifestyle, and medical care. And this one right here, I want to stress that environment has become really one of the central focuses of public health, because if a person lives in a community where they can't get access to something, or the environment is creating hazards on their health and well-being, then that's something that needs to be addressed. Meanwhile, the medical model, although it's very, very important, it has a different focus than the public health. It focuses in on the individual. It looks at the ethics for the individual person. It focuses in on diagnostic and treatment. Basically, how can we give a pill or treatment or some kind of drug or do a surgery to really help this individual? And it treats the disease. It focuses basically on medical care. So you should see a difference here. And if we had to compare the public health model to the medical model, I think the one word that you would not see in the public health model is treatment. So that is not in public health. You notice that? It's basically the public health model is focusing in on prevention and looking at something before it happens. Meanwhile, the medical model is focusing in on treatment and a diagnostic approach in the individual. And you could see that, when you think about approaches, think about how the United States approaches basically the healthcare system. And do you think it uses more of a medical model or a public health model? Does the United States focus in on the entire population and on prevention? Or does the United States use more of a treatment focus? And I'm going to be asking, if you have class with me, I will be asking that question in class. And would be interested to see what you think. So when you think about public health aims to what? Provide groups of people with the right to be healthy and live in conditions that support health, or the individuals. And if you answered groups of people, you're on the right track. Fill in the blank with the correct answer. A blank is a disease occurrence among a population that is excess of what is expected for a given time and place. And I want to stress this. I said it a little bit in my introduction back there about what it is. And let's see if you caught it. What is it? What is that called? And the answer is an epidemic or an outbreak. Basically, an epidemic is anything above what is typically seen in a community for a disease. So, for example, if a community typically has 0 cases of a disease, and then all of a sudden has 5 cases of disease, that would be called an epidemic. Okay? I just want to state that if you answered pandemic is a worldwide outbreak. Worldwide. Okay? That's me attempting to spell world. Okay? Worldwide. Okay. So the answer was C. That was the right answer. An epidemic or outbreak. This is something that we would go over deeper in an introduction to public health class. But really key is that we're constantly looking for epidemics to occur. And we're constantly looking at these prevalence rates and incidence rates. So I want to go over these key terms so that you're familiar with them. Incidence rate are new cases of infection or of a disease. Okay, I should say, or disease. Okay, so, and this is me trying to spell back. It feels backwards. Sorry. There we go. Whoop. All right. My spell. This is craziness. There we go. Disease, right? Prevalence rate is a percentage of a population who have that disease. So if I told you 30% of a community have diabetes, that means both new and old cases. So maybe some people have just recently got diagnosed with diabetes, and it's the whole population, both new and old cases together. And often it's expressed as a percentage, right, per 100. Infant mortality is the rate of deaths per population under 1 year of age. So it's a number of deaths that have occurred under 1 year of age per population. And think about this. Infant mortality rate is something we constantly look at because infant mortality rate really shows the health and well-being of a population. If an infant mortality rate is high for a group of people or for a population or for a country, it really starts to show that maybe there's something going on with the healthcare system or there's something that needs to be addressed. So that's key for us to always be looking at this. And epidemiology is a study of disease outbreaks or epidemics. So these are some key terms that I would like you to be familiar with. All right, so that's the end of this first series. And now we'll be going on to the next one.